Welcome back, guys. We're going to go ahead and have Scott Cole is going to be coming up next, and he's going to be discussing medications and training. We did a switch with Mary. Mary's going to be at 2:30 for coaching business development, and so we're going to have Scott go here an hour early. So he's going to talk about the most common types of medications and how they may affect your athlete's training. So Scott, thanks for joining us, and you can share your screen, and Jackie's going to do a bigger introduction to you.
Okay, yes. Great, thank you.
We're fortunate to have Scott Cole here with us today. He lives in Massachusetts, and he's a registered pharmacist, and he's worked in the retail industry of pharmacy for the past 28 years. He is also a USAT certified coach. He has done many half and full marathons, including the Boston Marathon. And his first Ironman was in 2019 at that easy little Ironman, Lake Placid. I say that with sarcasm. So Scott, take it away.
All right, great. Thank you, guys. I'm so glad to be here. I'm excited. Can you see my screen?
Yes.
Are you? Okay. All right. Is that better? That's all right. So yeah, I've been a pharmacist 28 years, and I started doing triathlons about 10 years ago, and I really enjoyed it so much. I love triathlon, and I see a lot of need being in healthcare to promote healthy lifestyle and exercise, and so I decided to get my coaching certificate. I got it about a year ago, level 1 coaching certificate. And I was super excited about that. Fortunately, then Corona happened and things, I had some plans, but you know, we all change what we're going to do, but I'm so glad to be here. I'm glad Amy and Tim invited me today. So we'll get right into it. Let's see. It's my first presentation, so bear with me, hopefully. Okay, here we go. So today I just want to talk about a lot of the just more commonly prescribed and over-the-counter medications. Obviously, I can't go through every single medication out there. I need both days and more to do that. So our objectives today: review common over-the-counter pain relief medications athletes may use to treat pain and discuss possible effects. Review other commonly used over-the-counter medications and possible implications for an athlete in training. Review caffeine and its possible effects. Review diabetic medications, implications for training with various medication regimens, and to discuss other commonly prescribed medications and possible implications for training. So the first thing is over-the-counter, or what they call OTC pain relievers. A lot of us, you know, you get sore, you have soreness, or you hurt yourself, you'll go to the pharmacy, you'll pick up something, and there's generally like 2 classes of that type of medication that people would grab. The first being non-steroidal anti-inflammatory medications, or NSAIDs as we call them, ibuprofen, or better known as Motrin, Advil, and there's other ones, naproxen, which is also known as Aleve, and there's other ones as well under that name, and then there's aspirin. And so those are the non-steroidal anti-inflammatory medications. Then there's Tylenol, or acetaminophen, which is generally under the name Tylenol. That is more of a pain reliever, fever reducer. It doesn't really have anti-inflammatory properties. And then recently they came out with this thing just to throw a curveball in, the combination product, the Advil dual action, which is ibuprofen and acetaminophen. So there's that one too. Some people may pick that one up as well. So what people use them for, obviously, muscle soreness, strain, sprains, or fever. And the big things with the side effects on these, the NSAIDs, upset stomach, There are studies that show they possibly delay healing time in certain injuries. They can have blood thinning properties like aspirin. You probably heard of aspirin, taking aspirin for, older people take it to prevent blood clots. And I put this further injury possible for masking symptoms, meaning if you were to take this before you went, if you injured yourself and then you take it, like myself, for example, I have a nagging hamstring issue that's been going on, and I've been tempted to pop a couple ibuprofen before I go running so I can run further, but that obviously will increase my chance of hurting myself further because I won't know that I'm hurting myself as I'm running. Acetaminophen or Tylenol, this, because it helps with fever, it can also interfere with body temp regulation, a possible consideration if somebody's taking that and doing long or in the hot sun. And again, further injury possible from masking your symptoms. If you're taking it, it's going to relieve the pain, and then you go out and you do something, you might not realize that you're hurting yourself more. And then the combination products would be kind of obviously a combination of all of those possible effects: upset stomach, delayed healing time, further injury possible, and interference with body temp regulation. So in general, it's not recommended to use these before training or event. Like if you have an injury, like you shouldn't, obviously we don't want our athletes trying to just, run through the pain. Like I think Jenny was talking about type A, type B. I'm like a type A. I will try to run through it, but I know better than to try and take one of these medications before. And the other reason is with the NSAIDs, ibuprofen, Advil, Aleve, those can really bother the stomach. And if you're going to take that, I know when I did the Boston Marathon 2016, I was waiting in the corral. I heard somebody say, "Oh yeah, I just took a bunch of ibuprofen." Lo and behold, down the road, I see them on the side of the road throwing up. So it's definitely not a good idea to take an NSAID before a long, an event or training. So that kind of wraps that up with the pain relievers. So the take home is really, let me go back, just, not to really use those before a training or event, because you don't want to risk bothering your stomach, risk further injuring yourself because you don't really realize that you're sore or you're hurting yourself. I mean, they can be used after events. Take care, that's not a problem. I use them, people will use them, that's fine, but it's not to be used to mask your symptoms if you do have an injury. So the next thing not really, well, it is a medication, caffeine. We all know about caffeine. It's in some of the gels. It's in a lot of the energy drinks, things like that. And it does help, it can help athletic performance. You take one, you feel more awake, you feel more energized, and that, there's nothing wrong with that. But if you take too much, it can lead to certain side effects and certain issues. So like for myself, I know I'm a big coffee drinker. I'll have a cup of coffee in the morning before a race, maybe even two. I've learned over the years not to do that, because then if I pop a gel with caffeine in it, I'm a little bit anxious or nervous, and I tend to be one that I had issues with being nervous in the water swim, in the open water swim. So I realized I was taking a gel with caffeine and I was getting more anxious and nervous. So if people, athletes use too much of it, increased heart rate, upset stomach, transit time means you go to the bathroom more often, jitters, anxiety, frequent urination could lead to possible dehydration, obviously sleeplessness, headache. So you usually recommend about 400 milligrams a day is the max for adults, not recommended for children, and caution with adolescents. But it depends on the athlete too. A lot of people don't have as bad a response to it a quicker response as others. Some people can take a lot, some people cannot. It depends on the size too, the person's size. So just something to consider if the athlete tends to be nervous in the water, they probably don't want to have the caffeine gels before they go in. All right. Now, cough and cold, allergy, stuff. There's a ton of products out there. I try to simplify it as much as possible. I know, people come in all the time. What's the best one? There's so many of them. But most of them consist of about 4 main categories of medications in them. There's cough suppressants, expectorants, antihistamines, nasal decongestants, and fever reducer pain relievers. Those are the 4 general things that are in a lot of these cough and cold preparations. Again, there's certain things, if somebody, I know I've done runs or rides with a cold. If somebody takes any of these medications, there are certain considerations. Rapid heartbeat, jitters, anxiety from decongestants. That's the big one. These nasal decongestants, a lot of them you have to buy behind the counter now. You actually have to go to the pharmacy and ask for them. So those are like Sudafed, pseudoephedrine, or phenylephrine. So those can sometimes make people feel jittery, rapid heart rate. Antihistamines, some of them can cause drowsiness. So if somebody has allergies and they're taking antihistamines, it could cause you to be drowsy. So it may not be a great idea to take if you're doing a spring or springtime race or something. They'd want to avoid the antihistamines that cause drowsiness. They want to get a non-drowsy antihistamine. And then body temp regulations with the fever reducer, pain relievers, and upset stomach, nausea from cough suppressants, fever reducer, pain relievers like the ibuprofen and things like that. So those are just some considerations, but the big thing is the decongestants, making your heart beat faster, giving you anxiety, jitters, not being able to sleep at night. Like if somebody has a race in the morning and they're really stuffy and they take a decongestant, they'll be restless all night long, even though often I'm like that either with or without taking one, but that would be a consideration. I'm going too fast. So diabetic medications. This is a big thing, I think, because there are a lot of people that have diabetes nowadays, especially over the last 3 decades. I've seen, it's gone from a few medications they had to like, it's just, you see the commercials on TV. There's so many different medications because there are so many diabetics. And there's 2 types. To type 1 is insulin, what they call insulin dependent type 1. That's usually genetically inherited. And they require insulin because their pancreas doesn't make insulin. So they have to have insulin. And these, a type 1 diabetic athlete usually are really aware and knowledgeable about their condition. They've probably had it most of their lives, and they know how to check their level, glucose levels. They know exactly what to do if they get low and their diet and everything. So those people generally are more aware, knowledgeable about what to do in different circumstances. Type 2, or what they call adult onset diabetes mellitus, it's maybe genetically predisposed, but we don't really know. That's the type that people acquire later in life usually. A lot of times it's connected with a sedentary lifestyle and things like that. So not necessarily, but that's sometimes often what it is. Sometimes they will require insulin, but most often they're on oral or other injectable type medications. Pre-diabetes is these people, before they actually are diagnosed with having diabetes, type 2 diabetes, there's a condition called pre-diabetes, which it's, markers for that they could develop type 2 diabetes later. So often I put that on there because some of these people may come to us, I want to get healthy. I want to exercise. I want to do what better my, decrease my chances of getting diabetes. And that's usually lifestyle modifications can decrease the severity, or they could even reverse it when they have pre-diabetes. So those people usually aren't on medications yet. They're there's just borderline. So they have to be careful, increase their activity and watch their diet and things like that. And they can prevent developing type 2 diabetes. So we may see some athletes that come to you that are in that position, which is good, because then we can help them in that way. However, like newly diagnosed persons with type 2 often have frequent medication changes. And so this, if we have an athlete that's just diagnosed with type 2 diabetes, they may be on different medications. We have to be very careful when somebody's on a new medicine. Their blood sugar, they have to be very watchful of their blood sugar. If they, generally weren't active and all of a sudden become active, they can get low blood sugar a lot easier. So those are, considerations for that. I mean, it's obvious, people aren't going to necessarily tell us what they take, but it is good to try and keep an open relationship with, and if they have a certain medical condition, they would tell us. I know there's the assessment form that people usually fill out for that. But again, with these type of things, we're not in a position, me being a pharmacist, to tell somebody you should stop your medicine or you should do this or you should do that. That's always from their doctor. We're not here to say you shouldn't do that or you should do this or you should increase that. We can't do things like that. We just, just to be aware and what to possibly look for. So continuing on, like I said, there's a lot of different medications out there now for diabetes, and there's a lot of complex regimens that people are on. The insulin, it's short acting, intermediate, or long acting. There's other types of injectables. You've probably seen the commercials on TV. They're usually given once a week or monthly. And then there's oral medications, several classes of medication, variety actions that decrease blood glucose levels by increasing insulin sensitivity or actions. And all medications, the point is all medications have potential risk of hypoglycemia or low blood sugar. So especially when somebody's newly diagnosed and they're put on something, it's kind of, the risk is much higher then. So diabetic self-monitoring, like I said, a lot of patients, most of them, if they've had the disease for several years, they're very good. They know exactly what to look for. They're testing their blood glucose levels. They're checking everything. So they should, for exercise or training and things like that, the blood glucose levels should be checked before, during, and after an activity. Longer activities may require more frequent testing. Type 1 diabetics actually may have a higher blood sugar post exercise. Depends on the length and the intensity of the exercise, because they don't have insulin the body requires more glucose when you're exercising, and it builds up, and then they don't have the insulin to get rid of it. So they may, I say sometimes, have a higher level after the exercise. Again, depends on how long they've been exercising and the intensity. There's a lot of advanced technologies out there to help these athletes stay on top of their condition. It's been amazing, the technology that's come out now. Continuous glucose monitoring devices, like it's basically something they put on their arm, and then they just have to wave something in front of it. It'll tell them their blood glucose levels throughout the day. It's great. And then there's insulin pumps. People you sometimes see with the little packet, and it just pumps in the insulin as needed, based on a regimen by their physician. So obviously physical activity may require an adjustment of insulin and/or medications, but again, this is only done with the consult and approval from their doctors. This is not something that we would get involved in. It's just to be aware that if they're doing more exercise and longer exercise, they may need to talk, they should talk to their doctor about if they need to adjust things. Symptoms of low blood sugar. Probably a lot of you guys know this already: dizziness, sweating, weakness, confusion, lack of coordination, loss of consciousness, and up to seizure. So all diabetics, type 1, type 2, should have a readily available fast-acting source of glucose or gels or fast-dissolved tablets in case of hypoglycemia, low blood sugar. And again, most diabetics do know that, but it's always good to remind. I know I'm not diabetic, but I did a marathon, and my first marathon, and I was in such a rush, I almost missed the starting line. I didn't even bring any gels with me. Somebody dropped a gel. I ended up picking one off. It's kind of a crazy story. It wasn't open, so I used it. I picked it up off the ground and ate it because I was getting so lightheaded. And I ended up walking the last 4 miles. That wasn't good. So definitely for a diabetic athlete, it's very important. Okay, heart and blood pressure medicines. Again, I'm trying to really generalize all this. I mean, I could be here for days talking about all the different medicines there are, but I'm just want to talk about the ones that are most commonly prescribed that you see. And, we could have athletes on different blood pressure medications. So just kind of want to go over, what that could mean. So the big ones are, there's beta blockers, diuretics, or people call them water pills. There's ACE inhibitors, angiotensin converting enzyme inhibitors, or ARBs, angiotensin receptor blockers. Those are, they work through the kidneys to help lower the blood pressure on the angiotensin renin systems. I don't know if some of you may know that. And then calcium channel blockers. So the beta blockers, some examples are propranolol, atenolol, metoprolol, and labetalol. Often used for blood pressure, heart conditions, but they can be used for anxiety, withdrawal, and have been used. And this is where I think it kind of ties in. They have been used in certain sports requiring steady hands and, kind of to calm your heartbeat down, like archery, shooting, golf. But that is on the, some of these medicines are on the World Anti-Doping Agency banned substances, obviously. So if somebody's on these prescribed by a physician, that's one thing, but they're not allowed to be used for those things. But that wouldn't be something in endurance sports we would see. This is more for things that require slower, steady hands, things like that. So because of that, these medicines do slow heart rate, and they can reduce stroke volume and affect the athlete's ability to achieve maximum aerobic heart rate. I missed rate on there, sorry, I should say heart rate. So that's one thing that, would be a consideration if somebody was on one of these. They, obviously would need to talk to their doctor and get a consult, or, decide maybe if that was, to let their doctors know that they're going to be doing this type of activity if they are on those type of medicines. And they could also cause electrolyte imbalances. So the heart and blood pressure medicines continue. Diuretics or water pills is hydrochlorothiazide, furosemide. There's a whole bunch of them. This is just a short list. And as you would imagine, they increase urine production. They reduce blood volume. That's how they lower blood pressure. But by doing that, they can also cause a loss of electrolytes, sodium, potassium, which could lead to cramping, dehydration, sun sensitivity. And many of these are also on the World Anti-Doping list. So, because I apparently, again, not used the right way. They're used and have been anecdotally used in athletes to flush their system of certain other substances. But somebody that was prescribed these medications, that's obviously for a different reason. But they are at higher risk for dehydration and low electrolytes. So it'd be important to make sure these, as in everybody, we all need to make sure we're hydrated properly. But especially with these, they need to make sure they're replacing the electrolytes. The next group is the ACE inhibitors, or ARBs. These are lisinopril, quinapril, enalapril, and there's a whole bunch of other ones. Chronic cough, they can cause fatigue or dizziness. Again, they can possibly cause electrolyte imbalances, sun sensitivity. But this group of medicines have minimal impact on the cardiovascular performance measures. So it's, for some athletes, it might be a better option to control blood pressure. Um, and that again would have to be something from their doctor or physician. And then the last group, the calcium channel blockers, called verapamil, amlodipine, diltiazem, and there's a bunch of others. Is that those also lower heart rate, can also cause electrolyte imbalances and sun sensitivity. So all of these different blood pressure medications, as if you can remember, they can all cause electrolyte imbalances in some way or another, because they're affecting the blood volume, they're affecting the cardiovascular status. So they can cause electrolyte issues. So it's important for athletes to make sure they stay hydrated and not just drinking water. I mean, that's true for all athletes. As you do long, you don't want to risk low hyponatremia or low sodium. So that was just an overview. There's so many medications, and obviously, again, athletes aren't necessarily going to tell us what they're on, but if they are taking heart or blood pressure medication, they should always talk to their doctor and let them know they're going to be engaging in these kind of activities. And it's helpful for us to know that. Now, stomach and ulcer medications, I picked this because so many people take these type of medications, and they can have certain effects on minerals and vitamin absorption. So these can be bought over the counter or by prescription. The H2 antagonists, what they're called, like ranitidine or Zantac, famotidine, Pepcid, you see those over the counter. There's PPIs, what they call PPIs. Those are the Meprazole or Prilosec, esomeprazole, Nexium, and other ones. Then there's like Tums chewable calcium tablets and milk of magnesia. The possible effects from these decrease the pH of the stomach. Obviously, that's what they want, so that the acid is reduced. But they can delay how long it takes your stomach to empty out, gastric emptying time. But the big thing on this is some of them decrease the absorption of certain vitamins and minerals. Example, B12, C, D, calcium, and iron. And that's the top two, the H2 antagonists and the PPIs. Not the calcium tablets or the milk of mag or those other ones. It's really those pill form ones, the ranitidine, Zantac, Prilosec, Nexium, those, because they suppress the parietal cells in the stomach, and it can really affect how some vitamins and minerals are absorbed. So if an athlete is on these and they're doing more exercise than usual, they may find, they're getting tired or whatever more easily. This slide is cut off, I think. It's vitamin B12, especially vitamin B12. It's involved in red cell blood production. So obviously, if they're low on B12, they can feel tired. They can feel weak, have no energy. But B12 is you can buy it over the counter. You can supplement B12. Your body, if you don't need it, it'll just flush it out of your system. So it's, something that a lot of people just grab B12. They find out they're low or they feel tired, or multi-B vitamin. But that's the issue with these medications. So it's the PPIs and the omeprazole, esomeprazole, ranitidine, Zantac. Those are the ones that do that, because those are stronger, really suppress the acid in the stomach. So, and we need acid to break things down, basically, if you want how you want to think about it. Let's see. So I guess I went through it. That's the end of the presentation. Hopefully I didn't go too fast. I might have. I apologize if I did. If we have any questions and answers.
We had a few questions. The first one.
I think we had Jackie freeze up on us, huh?
Yeah, I didn't-
She had texted me earlier. She had some internet issues. So,
Okay.
yeah, it was tagged. She was it for moderator. So she'll probably come back in. Yeah. So the first question, let me see. Are there any disadvantages of daily in SAIDs for joint pain that you know, Scott?
No, I would say no if you're taking it for a specific, a chronic like condition, or if it's prescribed by your doctor. Like I said, there are some studies that it shows that it delays healing time from injuries, but there's a lot of stipulation on that. So, I mean, if it's something that your doctor has told you to take because of a certain condition, it's better, that should be fine. But if it's just, if you're taking it on your own every day because you're getting joint pain from the exercise, that may not be the best way to do it. Obviously I would say talk to your doctor to make sure that that's okay. But like I said, there are studies that it shows it does delay some healing time. I mean, I take NSAIDs myself, not all the time, but I try to take it, intermittently if needed, but not consistently. Because the other thing is the stomach issues. If you take them all the time, it could lead to stomach issues as well.
Does taking statins decrease training performance?
Not that I know about. I mean, I would definitely want to double check on that. I've never heard of anything or know of any issues with that. Unless it's affecting the liver. I mean, statins, you do need to have your liver enzymes checked. So if it is affecting the liver, then it could have a problem. You could have a problem, but your doctor's supposed to be doing blood tests to make sure it's not affecting the liver and its functions. So if it's not, then it should be fine. Yeah.
Russet says, I have an athlete who swears by carrying Tums and Modium on the Ironman run just in case. Should I dissuade her from doing that?
No, the Tums, it's nothing wrong with the Tums. The Imodium, I mean, I know that's something that, it's an antidiarrheal, so your body can tend to develop, you get used to it, and so you kind of need it. I would probably have her talk to her doctor about doing that, because once if you keep using that, then your body gets adjusted to it, and you kind of need to use it. What is she using the Tums for? Is it just to like stomach upset or?
Russet, do you want to mute?
Yep, she is a person who she's got an apothecary when she travels to any race. She's like her own little mini pharmacist. I'm sure she's got more that she carries that she's not telling me.
Okay.
But that's she thinks of every contingency type thing.
Okay. Yeah. 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 I mean, I don't see a problem with the Tums so much as the Imodium, where again, if she's having GI issues, maybe there's something else causing it. Imodium just basically it just stops you from going to the bath. It masks.
Right. I mean, if she's having GI issues, you can make the argument she should be following her fueling plan.
Yes, exactly.
A little better than perhaps she is, right?
Correct. Exactly.
Yeah. Okay. Thanks.
Yeah. Well,
the other question I had that was part of that, since I have the spotlight right now, are there any over-the-counter medications that you would say, yeah, sure, that makes sense to have with you? Like you said, the Tums will do no harm, may or may not help, but anything else
to have with you?
Yeah.
I mean, obviously salt tablets, that,
yep.
but that's,
I think,
I mean-
I think this person also carries, which I'm not a huge fan of for a variety of reasons. I think she carries ibuprofen with her as well,
Okay,
which I will sort of
yeah,
give her a big X on that. Yeah.
yeah, I mean, yeah, again, taking it during or before an event, after is fine, but like
Yep.
during or before is just not a great idea, but
Okay.
I do have a bottle of ibuprofen in my car as well, but like for afterwards, not during, not to be taken during because of the stomach upset. And usually even after, you should wait a little bit. It shouldn't be right after because you want to let your body settle and not have that right away. But
So the second part of Russet's question, I don't think you asked this, Russet. Let me know if you did. Also, are there any medications you think that are okay to bring along with you on an Ironman course, just in case times?
yeah, I think she just,
Oh, did you say that?
yeah,
Okay.
certainly. I actually
Sorry about that.
like, a topical, rubs, certain things. Now it slips my mind. I can't believe I'm forgetting the name of it. The ice, the thing that people put on, topically is okay if they're getting sore, but
Icy hot.
yeah, that
Mhm.
I mean, I wouldn't recommend doing that if they're in the hot sun though. So,
Okay. Next question from Melissa. Any cautions with thyroid medications?
thyroid medications, definitely, again, you need to have your levels checked with your doctor, and it can, if it's too high, again, it can cause heart rate issues and things like that. So you definitely want to make sure your doctor has your levels checked and they're correct. And you're euthyroid, meaning you have a good, thyroid level is good. You don't want to be hyperthyroid or hypo. Hypo obviously will make you tired and not feel right. And then the hyper can have like that fast heart rate, jittery type thing. So you definitely want to have your levels, make sure your levels are correct.
You might have asked this about the thyroid medications. Do they suppress heart rate? Like if you're training heart rate zones, even if it's not thyroid, do you have any medications that will suppress heart rate?
That suppress heart rate?
Mhm.
Like,
Like, for example, someone's not on medication, heart rate zones are established. And then in the meantime, they go on certain kinds of medications. And then you just notice as a coach, like, they're, the heart rates
right.
their
Yeah.
heart rates are lower than what they normally are.
Yeah. So it was some of those blood pressure medications. I was talking about the beta blockers. Those suppress heart rate. Calcium channel blockers can do that too. They're prescribed, medication that are prescribed for blood pressure, but they can suppress the heart rate. Yeah.
Do you recommend in those kind of situations that we go to like more of a rate of perceived exertion, or if it's on the bike, do we go more of a power led training? What would your recommendation be, a pharmacist for that kind of situation?
Yeah. So it's going to be hard. Like with that, would be hard to go by the heart rate. I mean, like I said, some of the medications would limit the ability of the heart to go higher than a certain level. So, I mean, the power would be a better option, I would believe. I mean, I can get back to you on that. I can look more into it. I don't want to say for sure it'll be the best way to do that.
Yeah. If anybody has athletes that they've experienced and want to chime in and make recommendations, let us know. We have another question about effects of anti-anxiety and or antidepressants on athletes.
Okay. Yeah, I mean, I didn't get into that one as much. Certainly those medications, there's a lot of them out there. And with those type of medications to the people, it's often being changed or different medications tried, and they can have effect on mental alertness, or sleeping. Some can cause your ability to cope with high strenuous activities lowered. So it's just something that if a person is on those medications, again, they should talk to their doctor and check, make sure it's okay for them to take on a training program. But again, if somebody's being newly put on those type of medications, they have to be very careful of causing problems with mental alertness, sedation, not feeling right, exhaustion, things like that.
Jonathan asks, other than potentially masking symptoms, do topical painkillers have, and then we missed the rest of his question. Jonathan, if you can hear me, can you unmute and finish that question for Scott? John Falk?
Hi, yeah, sorry about that. Yeah, I was wondering about the effects of topical painkillers, if there is of the same level of potential risk as using a ingested NSAID.
No, typically they're not absorbed as much. Depends on which topical. There are different topical ones. There are some topical NSAIDs that still pose some risk. It's not as severe as if it's taken orally, but there's other topical medication, like a lidocaine patch. It's simply just a numbing agent, so it's not gonna carry the same precautions as the NSAIDs. That does depend on which ones you refer to.
Beth asks, if someone is on a beta blocker, would heart rate not be an appropriate metric to use for training, since heart rate would be artificially low? We already discussed that a bit. Yeah. David asks, how does aspirin affect ability to regulate body temperature manifest itself?
It's a good question. Because it's it is an antipyretic or fever reducer. It would, falsely, if somebody's getting overheated, you might not recognize those symptoms. I mean, I can look more into it and get back to you if you want to, leave the name and number or name and email. But because it does bring down body temperature, it would affect the body's ability to have the same reaction to overheating or overexertion.
Okay, and I think this is our last one here. Sienna questions this: does taking melatonin at night affect performance in a workout? And is there a certain time frame when it wears off?
I know a lot of people do take that. I've never heard of anything having effect like that. I think it doesn't have an effect for that many hours. So I don't think it would. I can definitely, again, look into it more. It's depends on the dose that you're taking. But I'm not aware that it does cause any issues like that.
And, oh, this is a good one. I'm surprised this hasn't been asked yet. What is your opinion of CBD?
I I've kind of had mixed feelings about it. I know I hear a lot of good benefits that it has shown. I don't have enough experience with it, I guess, to really have a great opinion about it. I know it is used a lot more commonly now. And I haven't had, like I said, a lot of experience with it to know if there's an effect with that.
Is there any other questions that our coaches have for Scott? Phil,
Scott, this is, I'm sorry.
Go
Scott, this is
ahead, Tim.
Tim. What can be some of the effects of things like antibiotics on training? What do coaches, athletes need to look out for if they are on an antibiotic regimen, be it short or long term?
Sure. So a lot of antibiotics can cause stomach, or most antibiotics can cause, because they get rid of your normal gut flora, they can cause stomach, diarrhea, and intestinal issues. So that's one thing. Many antibiotics can cause sensitivity to sunlight. And so if somebody was out training in the hot sun, you know, it's definitely not recommended on certain antibiotics. And the other thing is some have to be taken with food, some have to be taken without, so that you'd have to adjust that with your training or with your nutrition plan. But in general, like most antibiotics will cause stomach problems and possible diarrhea. And sunlight is another, potential. Many antibiotics cause problems with, or cause your skin to be more sensitive to sunlight.
Will they, can they cause, say, a reduced performance level as measured by an increase in perceived exertion, if that makes sense? Can things tend to just feel harder if you're on antibiotics?
I would say, if you have an active infection, yeah, that, it depends on what kind of infection you have. I don't think it would necessarily be related to the antibiotic so much as what is being treated. I've been on antibiotics and felt fine. Certain antibiotics won't, there are some antibiotics that are also have more larger side effect profiles and will make you feel worse than others. It does depend on the antibiotic. But in general, if you're treating an infection, you probably shouldn't be going out there going really hard and, putting your body under a lot of stress. Again, depends on what infection you're treating and what antibiotic is being given.
Chris Breen wants to chip in on David's question with aspirin on body temperature. So Chris, if you want to unmute.
Hey, Scott, great talk. I'm a physician assistant. I'm in orthopedics for 18 years, so I deal with some of these meds in different regards. To chime in on David's question with the aspirin and the regulation of body temperature, it's always been my understanding that although aspirin does have that antipyretic effect with fevers, it doesn't really affect people's normal body temperature. I don't know the exact, physiology or pharmacokinetics behind it, but I think it had something to do with the way the body reacts towards inflammation in the system, as far as it's in an infection that is fighting versus just the normal inflammation that's being raised from, your core body temperature from working out. So I don't think it has a great effect on
Right.
Yeah, correct me if I'm wrong, Scott, but that's always been my understanding of it. Just wanted to add those 2 cents.
Thank you.
Yeah, thanks, guys. Great talk, Scott. Appreciate it.
Thank you.
Thanks, Chris. Gretchen, you want to chime in about the Imodium with the Russet's question?
Yeah, so I had an experience a number of years ago. I was having GI issues and was diagnosed with small intestinal bacterial overgrowth, which the symptoms of that were alternating constipation and diarrhea. My GI doc put me on an antibiotic to address the diagnosis. But he said that he advised me that it was fine to take Imodium on race day, and even in a longer race, take the second dose later in the day. But with regard to Russet and the other comments, I don't take it regularly. I just take it on race day. So I just wanted to throw that in there in terms of my gastroenterologist did not see any harm in taking it in a race situation.
Thanks, Gretchen.
Nope.
Anybody else have a question? That was excellent, Scott. Thank you so much.
Thank
And you
you.
did a wonderful job. I was not a chemistry person, so that's why I'm not sitting in your chair giving that talk. So hats off
Thank
to you. A lot of information,
Yes.
but you know, it really is relevant with everything we see with athletes that are on our roster, because most of them are on some type of medication, minor or major, whatever it is. So it's good information to have. And again, like all of the other recordings we have, great one to go back to and reference in the future when we have more athletes with different kinds of medication conditions. So, so with that, you can unshare your screen. And we have, in about 10 minutes, we have Mary Miller, who is our marketing and sales director. She's going to discuss how to recognize your coaching assets as a set of tools rather than a set of services, how to build a professional self-marketing approach, and how to develop and maintain effective industry partners. So we'll take about a 10-minute break. And in about 10 minutes, we'll go ahead and reconvene, and Mary should be done with her meeting by then, and we'll get started with her. Sounds good, guys? Thanks.